Hello, everyone. Thank you all for joining the long-term care facility presentation for the Prevention Process Measures module. My name is Ty McCrae, and I am an infection preventionist contractor with the CDC. As your presenter, I will provide an overview of the prevention process measures for hand hygiene and gown and glove use event reporting in long-term care facilities. In today's presentation, I will introduce the Prevention Process Measures module. I will explain the protocol and definitions, provide instructions and illustrations on how to collect and report the data, as well as identify the resources to assist with data collection. The long-term care facility component prevention process measures module allows facilities to monitor adherence to prevention practices, including hand hygiene after contact with the resident or surfaces in immediate vicinity of the resident, and gown and glove use in the context of transmission-based precaution. I will now cover the Prevention Process Measures module for hand hygiene. There are multiple opportunities for hand hygiene during resident care, but our protocol is to monitor and record successful opportunities or missed opportunities of hand hygiene practices. Whether it's washing with soap and water or antiseptic process, of healthcare personnel, physicians, nurses, certified nursing assistants, therapists, technicians, etc., only after contact of performing resident care services. So, for example, that can occur within a resident's room or handled with equipment during therapy. Surveillance for hand hygiene adherence must include at least 30 different unannounced observations of varied healthcare personnel after contact with residents or performing a variety of resident care tasks during the course of the month. No personal identifiers will be collected or reported. While most of us know when to perform hand hygiene in our personal activities, it is expected for healthcare personnel to perform this task multiple times throughout an encounter. As you will see, there are 5 moments in hand hygiene which occurs frequently in your daily practice. I will share with you what qualifies for NHSN reporting within the Prevention Process Measures module. So for a quick example of a knowledge check, I would like to ask, how many unannounced observations are suggested to be performed each month? A, 10, B, 15, or C, 30? The correct answer is C. And the reason is the observer should perform at least 30 unannounced observations of varied healthcare personnel after contact with residents or inanimate objects in residents' vicinity each month. Next, we will discuss the reporting of gown and glove use. Multi-drug resistant organisms, known as MDROs, are increasingly common causes of colonization and infection in long-term care, which can be spread from resident to resident by healthcare personnel. Therefore, the gown and glove surveillance option will allow facilities to monitor adherence to gown and glove use when healthcare personnel utilizes appropriate practice, which is donning and doffing, when that resident is on transmission-based contact precautions. Again, we recommend that you perform at least 30 different unannounced observations for as many individual healthcare personnel as possible. Try to observe all types of healthcare personnel. That can include physician, nurses, therapists, aides, etc. Performing a variety of resident care tasks during the course of the month of which gown and gloves were used. Please note, both gown and gloves must be donned prior to contact for compliance. And again, no personal identifiers should be collected or reported. Policies and procedures may vary between facilities. Therefore, let's move forward with another scenario to determine what qualifies for NHSN reporting. What is considered the appropriate practice of gown and glove use by healthcare personnel? A, use of gown during interactions with residents who are placed on contact precautions. B, only when gloves are used. Or C, donning of both gown and gloves prior to contact with the resident or surfaces, objects in a vicinity of resident placed in transmission-based contact precautions. The correct answer is C. Appropriate gown and gloves used is the donning of both a gown and gloves prior to contact with the resident or inanimate surfaces or objects in vicinity of resident. If gloves are used without a gown, it would not count as appropriate use when the resident is placed in transmission-based contact precautions. Next, I will spend a little time talking about the data collection process and tools for NHSN. Healthcare-associated infections can be reduced with adherence to infection prevention measures. These practices include hand hygiene, gown use, and glove use. We have found it useful to monitor adherence to these prevention practices by ensuring that observations should be discreet, observations are as representative as possible of normal practice at the facility, and focused on an area of unit where staff interaction with residents are clearly visible. Most importantly, this exercise should not be a punitive process, but utilized as a teaching moment. Before I begin illustrating the process on how to enter the data, let's review the prevention process measures resources. Forms are available on the long-term care webpage and can be accessed by clicking on the individual module and then selecting Data Collection Forms tab. Once you click on one of these two links, you will be taken to the Materials for Enrolled Facilities page to review resources. NHSN forms and accompanying instructions are available for all of the data collection opportunities in the NHSN application. The form parallels are the required data elements in the NHSN application and is customizable, which means users are able to add additional data collection elements that are important to their individual facilities. Some important notes that I will mention. The PPM monthly monitoring form should not be used as an observation tool. This form should only be utilized for the person entering the aggregate data, which are the monthly totals, into the NHSN application. Here is an example of some observation tools that some facilities may utilize. These are not necessarily NHSN observation tools, but these are some that are used in order to collect their monthly observations of hand and hygiene and gown and glove use. Next, we will continue on the reporting requirements for the Prevention Process Measures module. Before you can begin reporting in the Prevention Process Measures module, users must include this option on their facility's monthly reporting plan. Facilities must indicate hand hygiene or gown and glove use surveillance in the monthly reporting plan by selecting that option. You must perform at least 30 unannounced observations of healthcare personnel interactions. And again, we strongly recommend surveillance to be reported at least 6 consecutive months to provide meaningful measures. The monthly reporting plan informs NHSN what modules a facility is following during a given month. So in order to get started with your monthly reporting plan, you must click Reporting Plan, then Add. And I must mention your reporting location includes all facility-wide inpatient units within your facility. 2, you would indicate the month and the year of what you're collecting. And 3, you would choose the hand hygiene, gown and glove checks box under the Prevention Process Measure module. And then you will click Save for your entry for the monthly reporting plan. I would like to also mention, although you may have a reporting plan in place, you still have the option to edit your monthly reporting plan. And to do so, you will need to select Reporting Plan, Find, and you can identify the month and the year of which monthly reporting plan that you are choosing to edit. Please note, if an event of data has already been entered for a selected month, the plan may not be deleted unless the event is also deleted. Therefore, we recommend, if you're choosing to edit your monthly reporting plan, make sure you have a note of all the information that was entered for the event before changes take place. This is an example of a completed monthly reporting plan for the Prevention Process Measure surveillance options. And as you can see, hand hygiene and gown and glove use were both selected for the monthly reporting plan. For every month in which a monthly reporting plan is set up, facilities must also report denominator data into the application, also referred to as summary data. This must be done even if the facility did not identify and report events during that month. When reporting summary data, please note only aggregate data is entered into the NHSN application. Summary data is only reported after the month ends, and the best practice is to enter this data within 30 days after the end of the month. This is an example of a completed monthly summary data for the Prevention Process Measure module reporting. How is this data meaningful? The data analysis options within the application allows users to calculate rates of adherence, performance among healthcare personnel in the facility. The NHSN data can be used to provide feedback to healthcare personnel on their adherence to hand hygiene and/or gown and glove use. And this data provides the ability to assess the impacts of efforts on a facility level, which can be used to demonstrate trends and improvements of or areas of opportunity. Here's an example of what the prevention process measures analysis report would look like for a rate table and a line listing. And I would like to point out, analysis reports can be generated by the quarter, the year, half a year, and every month. Here's a recap of what we covered for the prevention process measures. You can perform monitoring of hand hygiene or gown and glove use or both. To get the most from your data, we recommend minimal reporting of 6 months during a calendar year. Monitoring should include all types of healthcare personnel throughout the facility and enter a minimum of 30 observations per month to provide meaningful measures. It's also good to know that long-term staff can be trained to perform the observations, to collect the required data elements, and to analyze the data. And staff can include professional nursing staff, your infection prevention and control staff, and even your primary contact or facility administrator. Next, I would like to share some resources. The long-term care component has various resources such as training materials, our protocols, our data collection forms, and etc. If you need additional assistance, you can reach out, submit your inquiries to nhsn@cdc.gov if those resources do not provide an adequate response that you may need. This concludes our presentation. Again, if you need to submit your question or your inquiry to NHSN, please send to nhsn@cdc.gov and add PPM reporting to your subject line in order to have your inquiry routed to the appropriate subject matter expert. We will be happy to assist.